Welcome to the third video in the series, Management of Patients with Chronic Conditions, Medicare's Coverage of Diabetes Care Within the Wellness Visit. This presentation is designed to support healthcare workers in understanding diabetes self-management training. This series was originally hosted by Superior Health Quality Alliance and presented by National Government Services in January 2023. During this presentation, you will learn the requirements and services included in diabetes self-management trainings.
And on this slide that you're seeing before you, it's our disclaimer that says basically we are a contractor of the federal government, and we get our information from CMS, which is the Centers for Medicare and Medicaid Services. And we rely also on Congress and Health and Human Services to determine law and regulations. And as a Medicare administrative contractor, which Kathy will go in more, we implement those laws and regulations as such. Okay, for the next part of the presentation, I will be discussing the Diabetes Self-Management Training, or the DSMT. Next slide. All DSMT programs must be accredited and meet qualifying standards by a CMS-approved national accreditation organization. Currently, CMS recognizes the American Diabetes Association and the American Association of Diabetes Educators and the Indian Health Service as approved national accreditation organizations. Programs without accreditation by CMS-approved national accreditation organizations are not covered. Certified providers may be asked to submit updated accreditation documents at any time. There's a note here on telehealth. Next slide, please. CMS noted that registered dietitians and nurse practitioners are also eligible distant site practitioners and are permitted to furnish and bill for telehealth services, including outside the circumstances of the PHE for COVID-19. All medical nutrition therapy and diabetes self-management training services, with there's one exception of the codes G0271, are on the list of telehealth services. Please note that during the PHE for COVID-19, these telehealth services are among those that may be furnished via audio-only telecommunications technology. Audio-video technology is not required. Also, it's good to note that the public health emergency was extended just recently from last week to April the 11th. Next slide, please. On this slide, you'll see a designated certified provider will bill for DSMT services. CMS is designating all providers and suppliers that bill Medicare for other individual services, such as hospital patient departments, renal dialysis facilities, physicians, and durable medical suppliers are certified. All suppliers such providers who may bill for other Medicare services or items and who represent a DSMT program that is accredited as meeting standards can bill and receive payment for the entire DSMT program. Next slide, please. Here's a question. Can pharmacists bill Medicare for services provided by an accredited DSMT program? The answer is a pharmacist can be an instructor for an AADE accredited or ADA recognized DSMT program, but they are not recognized as a Medicare provider and therefore cannot bill independently. For Medicare patients, pharmacists are not recognized as a Medicare Part B providers. However, registered dietitians are eligible to bill on behalf of the entire DSMT program and must have a Medicare provider number, specialty 771. Next slide, please. For coverage by Medicare, DSMT programs must incorporate the following requirements. The DSMT program must provide services to eligible Medicare beneficiaries that are diagnosed with diabetes, and the DSMT program must submit an accreditation certificate from the ADA, the AADE, or IHS to the local Medicare contractor's provider enrollment department. Next slide, please. So what services are included in the DS&T program? It includes the following services: instruction and self-monitoring of blood glucose, education about diet and exercise, insulin treatment plan developed specifically for the patient, and motivation for the beneficiary to use self-management skills. Also, DS&T has requirements for coverage. It has to be ordered by a treating physician or qualified MPP managing the beneficiary's diabetic condition, and the oral referral must include a statement signed by the physician or a qualified MPP in that service area, and the number of initial or follow-up hours of training ordered can order less than 10 hours but not exceed 10 hours. And it also must include topics to be covered in training. It can either indicate individual or group training determinations. Next slide, please. Oftentimes, our providers that provide DS&T ask, how can I verify DS&T and MNT hours? I will go in a little bit more about MNT here shortly, but there is a tool called NGS Connects, and Kathy will discuss that a little bit further. But it's basically a web portal that provides DS&T and MNT eligibility information to show initial date of service, minutes of initial time remaining, and minutes of follow-up time remaining. Next slide, please. Beneficiary eligibility. Coverage of services only for beneficiary diagnosed with diabetes mellitus, fasting blood sugar, which is greater than less than 126 milligrams, or two different occasions. 2-hour post-glucose challenge, greater than less than 200 milligrams on two different occasions, and random glucose tests over 200 milligrams for a person with symptoms of uncontrolled diabetes. And also, A1C is not acceptable for supporting a diagnosis of diabetes. It's in the regulation that cannot be the only reason to receive DS&D.
Thank you for listening to this session. We hope you'll join us for the other 3 videos in the series, which are Understand the National Government Services Role as a CMS Administrator and Educational and Self-Service Resources, Medicare's Annual Wellness Visit, and Medical Nutrition Therapy.